All right, this is Goat 911 Part 1. It is part of a Goat 911 series that I actually developed just the first of Goat 911 a couple years ago when we were doing in-person programming before COVID, because I was getting a lot of calls from people who didn't know if they had emergencies or not and didn't necessarily have a great relationship with a vet or a vet at all. So I thought it was important to teach people how to maintain that relationship with a veterinarian, how to find a veterinarian, and how to recognize when your animal is sick. Some things you can do at home before you call the vet or as you're waiting for the vet. But the primary goal is to make sure that people get to a vet when they need it. So I started that. We did in-person programmings. The original one was a 2-hour in-person session. I have split that up to make it fit the 1-hour time slot that we allot for this. And so it's not too much information all at once. This first one will cover more general information. The second part of that will cover more illnesses and diseases. I've added a new one for trying to diagnose and figure out what's wrong with your animals. And then we'll finish off with some parasite education at the end. I have done this one several times for backyard farming, but we always get new followers. So I wanted to and people are always getting sheep and goats. So I wanted to give people a chance to get caught up on it. And also it is called Goat 911 because it was originally developed for goats. Goats are more popular in my region than sheep, but there's a lot of similarities amongst all small ruminants, goats, sheep, alpacas. So most of this information can be used for either. All right, and as another disclaimer, this presentation does not replace a veterinarian. If we use a website or a brand, it's just what's available to us. You're going to find that different products are available in different regions. These happen to be what's available in my region that I can take a picture of and use as an example. It is essential to have a veterinarian in the event of an emergency. Especially if you're in an emergency, you have to have that good relationship for them to come out, stop what they're doing, and come out and help you. This is only going to cover some of the common problems that you may encounter when you raise them. There's always going to be that 1 in a million thing that your animals get into. But the main idea behind this is I would rather prevent the diseases and not have them be a problem at all. All right, so why is this important? So recognizing illnesses quickly is critical to successful treatment. Sheep and goats, they're prey animals. Some of them will hide their illness until it gets very serious. So once you do recognize it, if you recognize it quickly, you might still be behind the 8 ball on it. You'll learn to find an appreciation for the drama queens. I call them the drama queens in my flock. The least little bit of a fever, they go off feed, or they have the least little bit of an upset stomach, they don't want to eat. So they let you know very quickly that something's wrong with them, but not all animals are like that. And you may end up with a variety within your flock. You, as the person who sees your animals and interacts with them on a daily basis, you know your animals best. So what's normal for your animal might mean for my animal might mean that they're sick, and vice versa. So it is important to know what is normal for your animals and what they normally look like. There is a lot of good information out on the web. It's very nice to have that all, just be able to do a quick search instead of having to run inside, find a book and look it up in the book. But there's also a lot of bad information out there. I mean, just because apple cider vinegar cured your goat's urinary calculi may have been a coincidence. It may have actually helped, but that doesn't mean that it's going to help another person's. That may have been a very mild case, caught very early, versus someone whose goat has a very serious case. There's differences in anatomy. So everybody has their home remedies that may have worked for them. They may not have. And they think that that's going to work for everybody. So you have to be very careful weeding through all of that information, especially when you get into social media groups and chats and stuff. I found good information that helps me, but I also, because I have a large background with this, I also know I easily recognize bad information as well. Most of the medications that and dewormers that we use for sheep and goats especially are either prescription or off-label. That requires a valid relationship with your veterinarian for you to use it. Now that the veterinary feed directive is fully implemented, you might find a couple of injectable antibiotics left over with the old labels on them that you could still purchase, but they're going to be few and far between. I just did a search from a website that I use, and I was able to find one antibiotic that's got the old label on it that they're still able to sell over the counter. It's an oddball one that I've never used before, but everything else comes up that it's out of stock, and it would all go under the prescription now. So that is something that has changed within the last year, even so. And then large animal vets are in short supply, and it seems like they're getting in shorter supply as time goes on. Just a few years ago, you might be able to get a vet that's not your vet to see you in an emergency. Now, very few of them will even consider you in certain areas. Like in my area, if you don't already have a vet that you are a patient with and you have a relationship with, they're not even going to talk to you. A lot of them are not taking new patients because, again, there's less and less of them each year. It is important to follow. That is one good thing about social media, is sometimes you can discover that there is a new vet that has come to your area or close enough that they can be in the general vicinity, the general region, within driving distance. So that is something that you want to keep an eye out for, and you're going to have to keep an eye out for if you do not already have a relationship with a veterinarian. So with any animal, it's important to know what is normal for them. And we call these the vitals. Their temperature, heart rate, respiratory rate. This is stuff that if you take your animal to the vet, whether it's a dog or a goat or a sheep, the first thing they're going to usually do, unless there's blood gushing or something that needs to be tended to right away, they're going to take the vitals. And if you call your vet and say, I think my animal's sick, they might ask you some of this information. So it's important to learn how to take a temperature, how to listen for a rumen sound, and know what's normal, so that one, you can call the vet, you're going to save them time, possibly yourself money. It may be that if you have a great relationship with your vet, they don't even need you to bring the animal in. If they've already seen that animal that year and it's something simple, they might just tell you how to treat it. But it is normal. It is very important to know what's normal. So in a goat, the normal temperature is going to be 101.5 to 103.5. That's very similar to what a sheep's would be. There might be a little bit of a difference, but usually not a whole lot. This is taken rectally. You can't take it in the ear. You can't take it under the tongue. This has to be taken rectally in animals. One thing to keep in mind, that if you have to chase an animal down and it's 85 degrees, it's sunny, and it's noon, their temperature is probably going to be a little elevated. If they're very stressed, they're very nervous, like you take your dog to the vet and it's extremely stressed, it's shaking, it's just beside itself, its temperature is going to be elevated. So in those situations, unless your animal's off feed and you're taking the temperature to verify that it has a fever, when in doubt, it's okay to put it in the barn in a stall for an hour or so, let it calm down, and then go back and recheck. The heart rate should be around 70 to 80 beats per minute. Again, that could be elevated if you're chasing the animal down and you haven't allowed it to calm down, or it's very nervous. The easiest way to take a heart rate is to count the beats per minute for 15 seconds and multiply that times 4. That'll give you the beats per minute. You can use a stethoscope. The cheap one, you can get them for $10. You can get the really expensive ones, or you can get the cheap ones. I have several cheap ones hanging around, but the cheap ones will usually work just as well. For rumen, this is important if your animal may have eaten something it shouldn't have, or overeaten. You want to listen for 1 to 2 rumen sounds per minute. You want to hear some activity in the rumen to make sure that it is working properly. And then for your respiratory rate, you're looking for around 12 to 24 breaths per minute. For this, you can, as long as you can see the chest rising and falling, you do not have to have a hold of the animal. If they're just laying there, you can go ahead and count the breaths per minute, do it the same way as the heart rate, count them for 15 seconds and multiply times 4. When I worked in a vet's office, that was usually the first thing I did before I put my hands on the animal, was I would stand outside the cage and go ahead and count the respiratory rate. And that way, in case they got nervous, that didn't affect it. I'd get the respiratory rate, then I'd go handle the animal, get the heart rate, and then the temperature last. And then another very important thing to look at in small ruminants is their mucous membrane. Sometimes this is the only thing that you look at, depending on what you suspect is going on, but this should be checked all the time. And that is where you're checking that lower eyelids and getting that FAMACHA score. They should be, the inside lower eyelids should be bright pink or red color. If it's pale pink or white, that indicates anemia. That could be, usually it's going to be a barber pole worm infestation, but if it was a weaned kid or a weaned lamb and it's, the weather's been nasty or they've been highly stressed, another rule out would be coccidia. It's always important to have at least the bare minimum for a first aid kit. If you can afford nothing else, get a thermometer. If you can afford a little bit more, get a backup thermometer. I prefer the 10-second digital thermometers. They work very well. It's not always easy to hold an animal for 90 seconds to get a temperature on them, but most of the time we can hold them for 10 seconds. But you want to make sure that that thermometer is going into their rectum. But the thing with thermometers is, sometimes when you need them, they're dead. So I like to have a backup thermometer. And then even the old glass thermometers, sometimes you go to use that and it's broken. So I always like to have a backup thermometer. Usually, depending on the area of the country you're living in, I'm in the mid-Atlantic. On the East Coast, barber pole worms is a huge problem. So we always need to have effective dewormers on hand. At least 2 from 2 different classes is the preferred. But always want to have access to them. I do realize they are expensive and there's a lot of product there. So if you don't have a lot of animals, if you are sharing products with someone because maybe you only have a couple of animals, you have a close friend that has animals and they've got the products, just be aware, do you have access to those in the middle of the night? How good of friends are you? Can you call somebody in the middle of the night and say, hey, I need some of that, need some dewormer because I've caught my animal down. They need to be dewormed as soon as possible, or an antibiotic or whatever it is. I like to keep some kale and pectin on hand. This is basically the same stuff you would take for a upset stomach. They do sell it specifically for livestock. It's basically Pepto-Bismol. You can use plain Pepto-Bismol as well. Don't use any of the fancier stuff, just the plain old-fashioned Pepto-Bismol. But this does help if you have an animal with diarrhea. It does help firm it up. It doesn't cure the cause of diarrhea, though. When I'm usually using this is if there's something, bad and I don't want them to dehydrate, but you also keep in mind when you are using something like that, that you want to address the cause of it. Injectable antibiotics are good to have on hand because your animals usually aren't getting pneumonia from 8 to 4, Monday through Friday. It's going to happen on the weekend or at night when the vet's office isn't open. So that is something you're going to have to address with your vet, especially now that everything's prescription. Ask them what they would like you to have, tell them why you need it, and ask them what they recommend that you have on hand. Usually you're going to have a broad spectrum antibiotic and or a penicillin on hand. And again, you should never, unless you have a huge flock of animals, you're not likely to use everything. If you are going through a whole bottle of antibiotics, you've got some management issues that probably need to be addressed. I'm running about 30 animals, sheep and goat combined. I've never, even with a couple of years, buying it and the expiration date being a couple years out, I usually don't even go through half of a bottle of antibiotics. If I go through that much, it's been a rough year. So it's not something that you should be using all the time. You shouldn't be using a large amount of these. B complex is something you can keep on hand. It has a variety of functions. It does help when they're sick in general, but it also has thiamine in it if you end up in a situation where you have polio. And then probiotics. Those are over the counter, just like the probiotics for us. They do make them for sheep and goats. They make them species specific, but that's something easy to have on hand. At the slightest hint of somebody with an upset stomach, you can go ahead and give it to them. Or if you know the animal's going to be stressed, you can go ahead and give them some probiotics and help ward off anything that might be coming. If you have to use a lot of probiotics, there's probably some management issues that need to be addressed. Some other things that you can keep on hand, you might want to consider, especially if you're in an area where there's a lot of toxins or poisonous plants. There's a product called Toxaban. It's activated charcoal gel. You can keep that on hand if that's something that you think you're going to need. Usually it's pretty inexpensive. Then bloat release is for the treatment of frothy bloat. So that's going to be something that will get you started with treatment. You're going to have to follow up with a vet. But again, it's fairly cheap and something to have on hand just in case. Everybody should probably have a drenching syringe, and those can vary in the style. Either way, you want a catheter tip if you're giving oral liquid medications. When you are using disposable syringes, you can wash them and reuse them when you're giving stuff orally. You're giving oral medications or oral supplements, you can reuse them. You can't reuse them when you're giving injectables. Those need to be sterile. But keep in mind that rubber does break down. So if you only have one big syringe, you might come to a point where you go to use it and the rubber has deteriorated or the plastic has cracked, and then it's no good to you. So again, always have more than one option available. For injectables, you want to have injection syringes and disposable needles. Those come in a variety of sizes, and you should consider, depending on the size of your animals and what you're giving, it can be anywhere from 1 ml to 5 mils usually for a lot of injectables. So keep in mind that so that you have the proper sizes. The larger bore needles are you going to need for antibiotics because those are a thicker liquid. So you need a larger needle for those in order to get them in fast. When you're dealing with an animal that it might hurt a little bit more, but it's better to get it in fast and get it all in versus fighting with the animal. If you use too thin of a needle, then if they fight you, they're gonna bend the needle, or it's gonna take forever to get the product into them. And that means you have to control the animal for that length of time. Topical antibiotics and antiseptic sprays are always good, just like in your own first aid kit. Antibacterial skin cleansers, for those, usually use like an iodine or a betadine. Chlorhexidine is a good one because it has longer activity when you are cleaning those wounds. And every once in a while, you're going to have some wounds that you have to clean. Some other things, if you have sheep, a Lewis shield is usually a good one to have on hand, especially if you're shearing them, in case you nick them. Then you can go ahead and cover it. It's like a liquid bandage. It comes out silver. A lot of people also use it for disbudding kids. After they disbud the kids, they'll go ahead and spray that over the disbudding area. Disposable gloves. I mean, you might not, the sight of blood, handling bloody animals might not bother you, but it is more for the animal's protection than yours in some cases. If you're walking from the house, even if you wash your hands, you walk out there to your animals, you open a gate, your hands are dirty now, versus keeping some gloves. I like to keep a couple of pair in a plastic baggie, and I just take that out there with me and I pull it out right before I handle the animals so that they stay clean. Some other things that you can keep on hand in case you need it are some things that will be similar to what you would have in a human first aid kit. Non-stick pads, those are the ones that don't stick to the wound. They have like that little glossy side to them, so that if an animal has an open wound, it's not going to stick to it and disrupt the healing process when you go to change it. Gauze sponges, I call them 4x4s. Those are usually used for cleaning wounds. You put some iodine on them or some chlorhexidine, and it helps you clean the wounds. Bandaging materials, it depends on how many animals you have and what your risk is. You want to have something that will pad, like it's called cast padding. A lot of horse owners use cotton rolls. In a pinch, you can use a roll of paper towels, but you have to have something that'll pad the bandage so that it doesn't constrict on there. I'll talk a little bit about that in a few minutes. Stretch gauze is usually what goes over that padding, and then vet wrap. Most of us are familiar with vet wrap because it comes in all those pretty colors, and we think it solves all of our problems, and we just want to have a variety of those colors because they're pretty. Then I like to have elasticon. I call it veterinary duct tape because it's extremely sticky and it holds really well. So if you are in a situation where you have to bandage an animal, whether it's because it has a wound or you think it may have broken its leg and you have to stabilize it before you take it to the vet, you always want to use a thick layer of cast padding or another soft material. Again, I've been in a situation where the only thing we had on hand was paper towels, so that's what we used. And then over top of that, this is called the Robert Jones bandage. So if you want more information about that, you can look that up, and there are step-by-step instructions on it, and probably a video as well that you can find that shows you how to do it. So you put that soft cast padding on there because that's what goes up against the skin. So you don't want to irritate the skin when you're bandaging an animal. You wouldn't want that for yourself either. And then use a couple layers of stretch gauze over the cast padding, and you can get that fairly tight. And that kind of holds everything together. Then if you need a splint, because the animal has either broken its leg or you suspect it's broken its leg and you have to stabilize it to get it to a vet so it doesn't have any further injury, you want to put the splint over that. The splint doesn't go right up against the skin. And some things that do work well for a splint on kids and lambs, I found is the straight edge of a plastic coat hanger. I have to use some of my fencing equipment to cut it, but that worked really well for me when I had a kid that broke her leg. And then over top of that, you wrap that with the vet wrap or flex wrap or elastic wrap, whatever it is that you have. And that kind of binds everything together, and that vet wrap really helps protect the whole bandage. And then you can wrap the elasticon. The elasticon is that little picture at the bottom of that tan 3M tape. You can wrap that around the top. And what you do is you get about half of that on the bandage itself, and half of that goes on the skin of the animal, the hair that's not bandaged, and it kind of holds everything. Because if you get on a straight leg, especially like those front legs or even a back leg, if you get a heavy bandage on there, by the time you get all this on there, it's going to weigh a little bit. You get that heavy bandage on there, it can slide off. So that elasticon helps keep everything there, and it also seals off the top of that bandage so stuff doesn't get down into it. It's not fun to take off, though, I will tell you. All right, when you are bandaging, again, you never want to use vet wrap or flex wrap without a thick layer of padding. Over time, they constrict and it can cut off blood circulation. So I did work for several years at a vet's office. We did a lot of IV catheters. And so once you take out an IV catheter, they've usually been in for a while and they will bleed for a little bit. So we have to put what we call a boo-boo bandage on it. So a lot of times we'll use a 4x4 and fold it up and put that over the hole, and then use surgical tape over it. But then when the owners get home, they don't like to pull that tape off because it's attached to hair, and animals don't like it. So, you would be nice and you would put vet wrap, which vet wrap is tight, so it helps stop the blood flow, helps it clot a little bit better. But usually the owners would you can only leave it on for about 20 minutes. The owners would forget, call us a couple hours later, say my dog's leg is swelled up. And then the first question is, well, did you take the vet wrap off? And the answer was always no. So you always want to make sure if it's going to be on there longer than 20 minutes that you have a thick layer of padding underneath it so that it doesn't cut off the blood flow. Now, if you're in a situation where there's bleeding and you need to cut off the blood flow, then you could use it as a bandage without it. But again, you want to that would be a situation where you just use that long enough to get it to the vet, let the vet evaluate it. Splint should go from the joint above the break to the joint below the break. Animals, if they have a broken bone, they need to be seen by a vet as soon as possible. But most of the time, the vet's going to want you to stabilize it for transport so that they don't have any further damage to the break. And then again, that elasticon, that's like surgical duct tape, is used to hold the bandage on the leg. Now for cuts and lacerations, one of the most important things for them is to keep them clean. You can use chlorhexidine products, iodine products. But you need to contact the vet as soon as possible if you need sutures. Wounds have to be fresh for suturing or stapling to work. If it's not fresh and you do take it to the vet, what they have to do, if that wound has started to heal, those edges have started to heal, what they have to do is freshen the edges, which means they're going to recut those edges because they need a fresh edge for it to knit back together. And that's not fun. That's going to require sedation most cases, probably going to cost you extra money. So if you are in a situation where it's a big wound and it needs to be sutured, then you need to contact your vet immediately. If a wound can't be sutured, because sometimes there's not enough skin there that can go back together, might be in an awkward spot. The sutures just might not hold together. The skin can granulate in. It's going to leave a scar, but usually, as long as it's not too big of an area, it'll granulate in. You just want to keep it clean, watch it for infection while it's healing. And I will give an example because I've lived through this. All right, so this was a Nubian kid, that she had broken her leg. Like 3 weeks before this picture, she had broken her leg. I guess she fell off of something, broke her front leg. So I had to stabilize it. I got her to the vet. Sure enough, clean break. They casted her for 3 weeks. We went back, it was healing well, but I didn't trust her not to damage it. And so I told him, go ahead, put another cast on it. So we did 6 weeks in the cast. Well, the second set of 3 weeks where she was in the cast, I had brought a terrier puppy home, and he liked to grab onto things. And I think what happened was he reached up and just grabbed her rear end, and she jumped and just ripped a big triangle skin down. So of course it was after 5 o'clock on like a Monday night. So the vet's office was already closed. Fortunately, I did have some staples there. This is not a great stapling job. I will tell you, this is not a great stapling job because if she was at the vet's office, some of those where there's some overlap would have probably been trimmed off to make it neater. But it did the job. I cleaned it, I closed it. I texted the vet because she was actually supposed to be at my house that Wednesday, and told her what happened. And she's like, okay, I'll take a look at it when I'm out there. She took a look at it. She said, it looks great, left it alone. She said, I'll take the staples out when we take her cast off. Because she was due to have her cast off in about 10 to 14 days anyways. So the second picture is when it had started to heal pretty good. You can see at the top where it was kind of messy when I stapled it. Those staples didn't hold, but it granulated in. And then a few weeks later, once the staples were out and really the hair started to grow back, you can see where there was some granulation there, but it all healed together. But that was probably within a half hour of the injury, she was stapled back together. And she was a kid, so it healed pretty quickly too. All right, so we've talked about vitals. I'm going to talk a little bit more in depth about that, like what does a healthy goat look like, or what does a healthy sheep look like? So the first thing is they're going to have normal vitals, which you might not have checked. You might be checking all these other things because you can just look out there and see these other things. But one thing that is normal for them is having normal vitals. And I put normal in quotes because normal can vary from animal to animal. Some animals might run a little lower and some animals might run a little higher than other animals. So again, it's important to know what's normal for your animal. They're going to be bright, alert, and responsive. This is actually something that we noted when we looked at animals in a veterinary office. Was, one of the ways we described them was bright, alert, responsive, energetic. With goats, you want them to have that tail up. If they're hunched in a corner and their tail's down, that's not good. When they come running up to you, you want that tail up. You want them eating well. One thing I will ask people when they say, I think my animal's sick, I'm like, well, is it eating? And usually people are like, oh yeah, it's eating. And then I go out there and it's nibbling at food. Well, most sheep and goats inhale their feed. You don't usually see them. Might see them nibbling at minerals, but usually when you put food in front of them, they're going to scarf it down. And then for a goat, you want to see a shiny coat, unless it's shedding, but most of the year, you're going to see a fairly shiny coat. And one important thing that I like to look for, if I'm in doubt about whether I need to go catch an animal and take its vitals and look at it more in depth, I'll take a look and see if it's chewing its cud first. If it's chewing its cud, odds are it's in pretty good shape. The opposite of that is, what does a sick goat look like? What does a sick, any sheep, goat, alpaca, what do they look like? Abnormal vitals. That means something is going on, something's wrong. No matter what it looks like, there's something going on with it if its vitals are abnormal. A lot of times you're going to see them more lethargic. And this can be very subtle. So it might just be that they're not keeping up with the rest, or they're reluctant to get up, or they're standing hunched in a corner by themselves. I walked up to my sheep tonight, and one of the ewes was laying down, and I'm like, my first thing is, something wrong with you? Because usually everybody's standing up at feeding time. And I gave her about 2 steps and she got up and I was like, okay. And she ran to the feed bunk. But when somebody's laying down and everybody else is not, that causes a little bit of concern for me, and I'm going to pay a little bit more attention to it. Again, not eating or just nibbling on feed, that is probably a sick animal. If you see them, they all of a sudden look sunken in, or there's a loss of weight. This time of year when we're starting to feed hay, they might be a little sunken in because you haven't got the fresh hay out there yet. So you put the hay bale out there and make sure everybody runs to it and starts eating. But if they're on their normal ration of food and they're sunken in, or you are starting to notice a loss of weight, then that is something to start checking on them. Sometimes it might just be that they have a higher parasite load and you need to take care of that, or it may be something more serious. Rough coat is usually an indication of something going on. A dirty tail either means that there's some diarrhea now, or there was some diarrhea. And then especially for the males, difficulty urinating, and for the females, frequent urination. So the males can have, we'll talk about this next week, they may have urinary calculi if they're having trouble urinating. The females usually don't get urinary calculi, but they can get urinary tract infections. It's what you're going to see probably more often with them. And you're just seeing a lot of them trying to urinate, but not getting a whole lot out. That sometimes can be a urinary tract infection. All right, so if you determine your animal is sick, what do you do? So you want to try to determine the cause, because you always want to treat the cause. So there's a couple of things that you do you can do right off the bat, like take its temperature. If you have a friend who is knowledgeable, you can go ahead and phone the friend and tell them what's going on and see what they say. Phone your vet. Most of the time, this should be the first thing you do, especially if it's like 3 o'clock on a Wednesday and that way they know that there might be something that if you have to take it in there, you'll be able to. And then run diagnostics. So this is going to be something you would have to have done at the vet, most likely, if you need immediate results, like a fecal or blood work, x-rays, stuff like that. You always want to treat the cause, whether your vet's going to want to find the cause when you're at the vet's office and treat that. If you're at home and trying to treat at home, you want to make sure that you are treating the cause. So always don't give antibiotics without taking a temperature on the animal first. And then if you have an animal that has showing signs of a parasite infestation, then you want to use a dewormer. You don't want to use an antibiotic for a parasite infestation. You can treat the symptoms to make sure the animal doesn't get sicker. So, an antidiarrheal, IV fluids are great because a lot of times animals, when they're sick, they're going to get dehydrated, and that's going to make recovery longer. So IV fluids can really put them back on their feet very quickly. The problem is you're going to have to take them to the vet for IV fluids. Most of the time you want to separate but not isolate them. They are herd animals, so complete separation from the other animals, unless there's a good reason for it, might make them feel worse. But keep in mind that sick animals a lot of times can't compete for feed as well. So they're going to need to be put in there with somebody who's going to let them eat once at the point where they can eat again. So if you have a severe parasite infestation, if they have bottle jaw, they're going to have a really hard time eating. So if they're out there with a herd, it's going to be really hard for them to get better while they're competing with 14 other animals for feed. And you want to give supportive care. That might include just extra hay, keeping them up, giving them extra hay, B vitamins, probiotics, stuff like that. Some supportive care for sick goats or sheep. You want to lessen the stress as much as possible. So you want to keep them close to their friends, but you might want to put them like in a neighboring stall. Make it easy for them to get food and water. Just like if you were sick, you don't want to have to drive to the grocery store to get food. You want to make it would be better. You'd like it a lot more if somebody brought it to your bed for you. And then keep them warm if needed. It might be that you have to put a coat on them. Usually don't recommend heat lamps because they are a fire risk. And they might not warm the area up as much as the animal needs. A coat might actually work better, but make sure they're out of the draft to have a smaller area so they can stay warm. When you have sick animals, especially ruminants, that rumen bacteria is also sick. So sick bacteria don't produce B vitamins, and that gets them into a lot of trouble with polio. So you may have to supplement those B vitamins, give them something like B complex. And then if they're off feed, one important thing to keep in mind is once they get that appetite back, ease them back onto their regular feed. So grass hay is usually pretty good. It's not going to hurt them, give them as much as they want. But if they're used to eating, a couple pounds of pellets every day and they go off of that feed, all of a sudden that appetite comes back and they want to eat everything. Don't just give that back to them, because then you may end up with another problem. And then keep in mind, when they are sick, it is better for them to be standing or laying sternal. You don't want them to be laid out flat. If you have to, prop them up, try to keep them up on their chest, and you can use a sling if necessary. You can make a homemade sling. I've seen homemade slings out of sheets if you need to, but you do not want them laid out flat. And if you don't know what I'm saying, they look like they're already dead. If you let them lay out like that, you're probably going to lose them. All right, now the important thing, why do I need a veterinarian? Again, most of the available effective medications and dewormers are not labeled for goats. If you use these, or some of them not labeled for sheep, once you get into the dewormers, more of them are labeled for sheep than for goats. But anytime you use a medication or a dewormer that is not labeled for the species you're using it on, it is considered off label. It is illegal to use these medications, whether it's an antibiotic, anti-inflammatory, a dewormer, off label unless it's under the direction of a veterinarian. A valid veterinary client-patient relationship, a VCPR, is necessary for a veterinarian to give you medical advice. If you call a vet and you are not one of their clients, do not be offended when they refuse to give you advice, because they put their license on the line if they were to do that. There's a few things they might be able to tell you, but they're not going to be able to do it. They're not going to be able to tell you to, go to Tractor Supply and buy some Sidectin and give to your goat without having that valid relationship with you. And they're getting, I guess, as they get busier and busier, in this area, at least, they seem to be even more strict on that. The reason being, veterinarians can give you guidance on withdrawal periods. So, if you're raising animals for meat or for milk, they can give you guidance on how long to throw away the milk before you consume it, or when you can butcher the animal. And they have access to information that we do not have access to. They can share information amongst themselves through some of their networks, and, get better treatments, say what's working, what's not working. So this is what is considered a veterinary client-patient relationship. This comes from the AVMA. So they're assuming the responsibility for what you do to your animal. So you want to have a good relationship with them, so that they trust you. They trust that you're going to follow through with their instructions on animals, because it is their license that's on the line, and they have a lot tied up. That's their livelihood. They have a lot tied up into it. All right, so how to build that relationship with a veterinarian. And it's going to be easier and harder for certain, depending on the area you're in. I'm in an area where there's not a lot of veterinarians who will see sheep and goats. And they're usually not full livestock vets. They're usually a mixed practice vet where their primary patients are cats and dogs. They'll see livestock certain days of the week, certain times of the day. But to get in for an emergency appointment can be difficult, because usually there's a cat or dog emergency that's taken priority. So you find a veterinarian who is knowledgeable about goats or willing to learn. Some of them might not know a whole lot about goats, but they're willing to work with you. Sometimes it's a horse vet that is willing to work with you with your goats. You can ask your county ag agent if they know of any veterinarians who are local. You can ask other producers in the area who they use and why. And the why can be important. Some of them might use them because they're cheap. Some of them might use them because they have emergency hours. It can vary why they chose that person. It might be the only option in the area. And then you want to establish once you decide on a vet, you want to establish yourself as a client. It's very important to ask them before you settle on a vet if they are accepting new patients, because some of them, depending on how many vets are at the practice, might not be. And then you can ask them, how do I become a client? Some of them might just have you fill out paperwork. Some of them might require you to have a farm visit or want you to bring the animals to them. They're going to have different policies on how you take that first step. And then you want to have a conversation with the vet. This is why a farm visit might cost you a little bit more, but it might be a better option for you, so they see how you're raising your animals, see what your setup is, see how many animals are on the property, things like that. So you want to tell them about your operation and what your needs are. And then ask about the office's emergency policy. Not all of them have emergency hours. In my area, there is an emergency vet for cats and dogs. So that means that the regular vet's offices do not have to have a vet on call at night. And if the vet that sees livestock is not the owner of the practice, they may or may not have access to the office in off hours. And they might not be willing to come to your farm in the middle of the night. They do need sleep, and their health is should be a priority for them. So you want to ask what their emergency policy is and see if that will fit your needs. So an important thing is to give the veterinarian your business. They do appreciate that, and they will work better with you if they're seeing you on a regular basis. And if it's a mixed animal practice, maybe that means you're bringing your dogs and cats in there for all of their vaccines and anytime they have a problem. But they're a business, and you need to spend a little bit of money with them so that they can pay their bills, they can pay their staff, they can pay their student loans and themselves, have a decent, make a decent living. This might be set up a farm call once a year. So if you have animals that are taken to the show, you can have the vet come to your farm to fill out your certificate of veterinary inspection for taking them to the show. And usually that will establish your animals as patients of that veterinarian. So if something does happen, you are a client, your animals are current patients that they can give advice on, or you can give vaccines on your own. But that might be how having the vet do your vaccines might be how you establish that relationship with them. This is very important for sheep and goats, and we have stressed this for years and years. I know Susan Shanian has told people over and over and over again with sheep and goats to take them to the office in an emergency. Sheep and goats they're not horses. They're not huge animals. Some of them are smaller than a large dog. Some of them might be the size of like a Great Dane. But usually, depending on the type of vehicle you have, you can get them in the back of a vehicle. We used to put sheep and goats in the back of my mom's Festiva all the time. So taking them to the office in an emergency is going to be a lot better for the vet. It's going to be a lot better, maybe a lot better for the animal, depending on what's wrong with it. But it's going to allow the animal to be seen faster, so you don't have to wait for the vet to finish what they're doing with the patient they're working on and then drive to see you. You can be driving to the office while they're finishing up and getting ready for you. It's going to be more comfortable for the vet. They have everything there that they need. They have a lot more resources at the office than they would have in their vehicle coming to your farm in a lot of cases, unless they're a mobile vet. But don't wait until the end of the day to contact them. Contact them as soon as you know that you have an emergency or you might have an emergency, so that they can get you in. You want to call the veterinarian as soon as the problem arises, and you want to use their recommendations. If you don't do what they tell you to, you're not going to build that good relationship with them. And then they also know that the earlier you seek treatment, the better the prognosis is going to be. And then here's another very, very important one. And my sister-in-law just ran into this, and I don't even remember. I think it was a goat. I think it was a goat problem because we use the same vet. She had mastitis, and it was an ongoing thing, trying to treat the mastitis. And then one day the vet wanted the kids to start nursing the mom. The goat had got mastitis before. We diagnosed the mastitis before the kids were born, started treatment per the vet's recommendations. The kids were born, the vet wanted the kids to nurse the goat. There's a problem with that. It was a first freshener, and her udder hurt. Her teats hurt, her udder hurt. So I told my sister-in-law, I said, as long as she's taking care of the goats, give them 4 days. I said, bottle feed them so that they don't starve. But usually around day 4, the kids are getting a better appetite. They're getting stronger. They start nosing around because you can't keep them full. And they find the teat and they start nursing the teat. And then when mom finds out that they're relieving pressure, she starts letting them nurse. So that happened right on day 4, like I told her it would. She walked out there and caught the kids nursing from mom. I told her, I said, let the vet know. And she kind of procrastinated it. And I don't remember if she finally texted her that day or it was the following day. But when she did, the vet responded with, thank you so much. I was having a bad day and this really made it a whole lot better. So they like to know when you have good news, because it does brighten their day a little bit that something went right. If things don't turn out good, that can be helpful for future cases. That can help them make decisions on future cases. And people wonder, it happens to me all the time. If I give advice, I wonder how things turned out with that animal, whether it was good or bad. I mean, I may have known that it was how it was going to turn out, but I like to have verification of that. All right, I added this one in because it is becoming a bit of more problem here recently over the last few years. What do you do if you don't have a local veterinarian available? So there's either no local large animal vets, or they're not willing to see livestock, they're not taking new patients, or it could be that they're not available for emergencies after hours. Maybe you can utilize them during the day, but after 5 o'clock on a Wednesday, they're not available, or they're not available Saturday and Sunday, not available on holidays. So another option might be for you to try to locate a large animal hospital with a 24/7 emergency room. With this, it's usually going to cause you more commute time to get there, because they're not going to be usually not in your backyard. For some people they might be, but for most of us, they're not going to be in our backyard. Usually going to be a couple of hours away. So in this case, you're going to have a plan for transportation. If the emergency arrives, again, they might be a couple of hours away, but don't wait until the last minute to seek treatment there. Because you might not have that time. And then all else fails, make a plan for emergency euthanasia. It's not wrong to put down an animal that's suffering or an animal that has a really bad prognosis. If you don't have the resources, whether that's a veterinarian or the money to treat it, it's better to put them down sooner rather than later. So always have a plan for emergency euthanasia. It's not the easiest topic, but it is something that you need to keep in mind when you have animals. Training. We have usually every state's going to have some integrated parasite management or FRAMACHA training. You can locate this training instructors, and sometimes the training's on wormx.info. They have a list of instructors. So if you can find somebody in your area that can teach that, so that you can get certified, especially if you're in an area where the barber pole worm is prevalent and going to be a problem. And that's a lot of places where that's a problem, but especially here on the East Coast, it's a big problem. We've had trainings here locally called All Worms All Day, where the whole day they brought in 3 or 4 specialists from the region who taught information on parasites all day. We've also had things like lambing and kidding school here, where you can learn. Usually there's a veterinarian speaker featured who talks about lambing and kidding, but also ag agent specialists who go into the different topics related to lambing and kidding, some things that you may encounter, things that you want to do to prevent issues with lambing and kidding. And then make sure you're seeking out reliable sources of information, those safe sources of information. Your county extension office is usually a good place to start. These are tied to land grant universities. And they can connect you to a small ruminant specialist in your state. So your county ag agent might not know anything about small ruminants, but they should be able to connect you either to a neighboring county or a closer county that has someone who is knowledgeable, or the specialist within your state. When you are looking up information, one thing you can look for is university websites. So to have a .edu on the web address. The information you find there is generally going to be research-based. You can find stuff called fact sheets or bulletins. Those have been peer-reviewed, so someone has written them who is knowledgeable, and then those are sent off to other people who work within, usually within universities, or who are experts, to review the content to make sure that it is accurate. Another place you can look for information is small ruminant consortiums. The wormex.info website is a small ruminant consortium. The members are, again, usually research and extension faculty from universities. And then your large animal veterinarians are good. If you have one locally that is your vet, that's a good source of information for you. So in conclusion, you need to know what is normal for your animals. Again, what's normal for your animals might not be normal for my animals, might indicate that my animals are getting sick, and vice versa. So you need to know what is normal for your animals. Get a veterinarian, make a plan. Again, if you can't get one for whatever reason, make a plan for what you are going to do in an emergency. Keep your animals well fed and in good body condition. They're able to withstand a lot of illnesses better if they're already in good body condition. If they're too thin, parasites are going to take them down really fast, and any illness might take them down really fast. Monitor for parasites on a regular basis. Minimize stress on your animals. I like to have eyes on, especially goats, at least twice a day. This isn't, you don't have to, but it's a good practice because you're going to catch, if you're looking at them every 12 hours, you might catch an illness 12 hours earlier, and that can make a big difference in the treatment or the prognosis. If you are new, get a mentor who can help you. This can be either another producer, or maybe the person you purchased the animals from. Sometimes paying those higher prices are worth it if you are getting access to that breeder beyond when you purchase the animal. So what are you getting? You might be paying a little bit more for it when you purchase an animal, but if that breeder is willing to answer your questions for the next 5 years, then it might be worth it to pay another $100 more for an animal from that person. Otherwise, find a friend, go to your county ag agent, or find someone with an extension who will help you. Most of the stuff that we offer in extension is going to be free, or some of our workshops are the cost of materials. We just charge for the cost of materials, a cost recovery charge. So we're not making we are nonprofit. We're not making a profit off of any of the services that we give. So the cost is going to be very minimal. The problem with that is we may have, depending on the location, you may have somebody in your county who's very busy and is not as available. So see what's available around you. Great books can be nice too. Be prepared. So have your thermometer ready. Maybe the stethoscope, dewormers. Be prepared for at least some of the more common emergencies. Use your resources. So get good books, attend the trainings that are available, whether they're online. Now thanks to COVID, we have a lot of online trainings, but a lot of times there might be something in person in your area. The more people attend trainings, the more we have trainings. So I'll give you a little extension secret there. If we offer something and it is well attended, then we're going to probably offer that again. If we offer something and only 3 people show up, we're still going to teach those 3 people, but it might be something that we don't necessarily offer again. Sometimes we'll try to regroup and, put it during a different time. So if something is available in your area, but you can't because it's held during the day and you work during the day. It doesn't hurt to reach out to whoever is putting that training on and telling them, I really would love to attend this training, but unfortunately, I work during the day. I'm only available on Saturdays or in the evening, or vice versa. Ask questions. And then one last thing is don't give up because of a bad experience. The more animals you have, the more bad experiences you are likely to encounter. There's some stuff that's beyond our control that we don't expect. And it's a learning experience from it. I've dealt with people, and some of them are my relatives, who started with very bad experiences with goats. And then, they learned, things level off. Sometimes you get animals and their main purpose is to teach you. So don't give up. It's usually worth it, but it is caution. Use it as cautionary tale. Reach out if you do have a bad experience, even if your animal dies, and you don't have time to reach out for treatment, you can still reach out and say, hey, this is what happened to my animal. Tell me what I did wrong. Tell me how I can prevent it. Or, I'm having some bad experiences. Can you come out and look at my setup and my management and see if there's something going on that I can fix? And then if you have questions, reach out. You can reach out to me. I'm in Maryland. But if you don't know who your county ag agent is, or you don't know who the specialist is and you're in another state, I can sometimes help you find that. I'm always willing to answer questions, especially if their email is usually the best way to get up with me. But if you contact me from another state, I'm going to try to connect you with someone more local, so that you can develop that relationship. And because one, they're going to know a little bit more about the environment that you're in than I would. I know the Mid-Atlantic. I don't know Idaho. Like John knows Idaho. He's a poultry specialist. I don't know that. I don't know that environment. That's very different. They have different things that we have. Parasites are the main thing that we have a problem with here. It's not necessarily going to be a big problem there. So it is always better. And the local person is going to know about what kind of weeds are around. So it's always better to connect with someone locally. But if you do not know who that person is, I can certainly try to find that person for you. All right, and I will take any questions that you have. You can put them in the chat box.